Welcome. It's noon, and we're going to get started talking about valley fever antifungals. And actually, I need to get on YouTube so I can see the questions. So let me do that real quick. Holy cow, I forgot to do that. Um, the reason I'm doing this live is because knowing about antifungals for a pet parent is going to supercharge your conversations with your vet. So, if you have at least some basic knowledge, you'll kind of know what they're talking about and and what they want to do, and then you can ask good questions. All right, so got that. I don't know if I'm on Instagram. Who knows? Um, but I'll watch. So we're going to talk about the major antifungals that are prescribed for dogs with valley fever and some of the not so major ones, and the indications for them, because it's important, it's super important to know. And it is overwhelming, so I totally get it. Valley fever in itself is freaking overwhelming. It's scary. Your dog doesn't feel good. You give them medication, and the medication makes them feel even worse. It's it's always a conundrum. Um, but the bottom line is, your dog is probably going to need pharmaceuticals, antifungal pharmaceuticals. They're kind of the mainstay of valley fever treatment, but they're going to need more than that. And I'll explain why. I actually have a new article out on Substack. Let me grab that QR code. So I have my latest article on Substack is on valley fever pharmaceuticals. So if you want some more details, you can scan the QR code and check that out. Okay. Um, and if you'd like, drop your dog's name in the chat and maybe say a little bit about their diagnosis story, because normally every dog story is not clear cut. It doesn't go in a straight line. Uh, there are ups and downs and a lot of trouble getting a diagnosis. The pet parents that I've talked to that have dogs that get an immediate diagnosis are rare, but they do happen. And I'm so happy for the pet parent, the dog, and I'm thrilled that the veterinarian recognized the symptoms right away and took action. So that's a step in the right direction. All right, let's pull that off the screen. Um, so you are your dog's best advocate. So the more you understand this, the better questions you can ask your vet, and the better you can take care of your dog and know what to look for. And sometimes I'll go over the side effects of these antifungal drugs, but sometimes it's hard to determine what's a side effect, what's really the valley fever that's worsening, or if it's even related to valley fever or a side effect, because some of the side effects of the antifungals are kind of bizarre. So I'm going to clue you in on some of the um, actually common side effects that some people don't know about, maybe even some veterinarians don't know about, and it can be very confusing on your dog's journey to getting better. Um, the antifungal drugs are powerful. Um, they're necessary. It's kind of a necessary evil, but they're only one piece of the puzzle. Um, and next week on Substack, I'm going to present an article on the herbal antifungals. So be on the lookout for that. Um, the antifungal pharmaceuticals or drugs, um, most of them don't actually kill the fungus, which is really interesting. Everyone thinks, oh, I'm going to put my dog on an antifungal and it's going to kill the valley fever and we'll be done. But most of the drugs that we use are fungistatic, meaning they actually just pause the valley fever. They kind of limit the valley fever from replicating and growing. They wound it, but they don't kill it. There are some drugs that are fungicidal, which means they actually kill the valley fever fungus. But most of the ones we use are fungistatic, which don't kill valley fever. So your dog's immune system has to kick in and finish the job. And that's the key. And that's what a lot of these dogs that are on just antifungals or just maybe antifungals and prednisone or like fluconazole and carprofen, like if they're only on that, we're missing the boat because we're not supporting their immune system so that the immune system can finish the job. Because dogs with valley fever, we know their immune system is crap because they have this horrendous chronic infection that takes 9 to 12 months or longer to get rid of, and a lot of times will disseminate to other parts of the body. And then we're in big trouble and we need to pull out the big guns as far as the antifungal drugs. But we also have to think about what we can add to the immune system, or to their protocol to support the immune system. So that's a really important point, and we'll talk about that unless you have questions now. So the first antifungal I want to go over is the absolute most common antifungal in use in dogs with valley fever. It's a first line antifungal, so fluconazole. Fluconazole is commonly, actually, it's, I don't think anyone prescribes anything but fluconazole first. It has excellent absorption, so the dogs can use it easily. So it gets into the bloodstream easily. It goes to the lungs, which is always where valley fever starts. So it penetrates the lung tissue really great. And the other good things about fluconazole is that it crosses the blood-brain barrier. So it's great for encephalitis, seizures, the neck pain, which is meningitis, and it also reaches the eyes. That's a tough one to diagnose, but we see valley fever in the eyes, causing eye swelling and other eye signs. If you want more information on um, symptoms, I would recommend checking out my book. You can download my book. It's an instant download for $9.99, and you get a healing toolkit with it, and all kinds of educational videos or videos explaining things. So my book, Conquering Valley Fever, there's the QR code for it. Lots of information on symptoms and diagnosis and treatment, and both pharmaceutical treatment and holistic treatment. So lots of great information there. All right, let's get back to what I was talking about. Um, so fluconazole. The other nice thing about fluconazole is it's easier on the liver than the older antifungals. And the older antifungal that we used to use was um, ketoconazole. And actually, I think that's what I was prescribed back in the 80s. I think it was, yeah, in the 80s, in 1982 when I had valley fever, and that's what we used to use, when I was right out of school in the 90s. That's what we used for dogs, and it was, antifungals are always expensive, so people would go down to Mexico and buy it, and I actually owned a practice, and I would contact a pharmacy on the Mexican border and send them a check, and they would send me ketoconazole. And I was always hoping that they'd cash my check and actually send me my ketoconazole because there was the possibility that I'd never see it, but I always did. They always sent me the ketoconazole so I could prescribe it to my patients and get it for less. less money. But ketoconazole is really not used anymore. It is cheap. It's the oldest antifungal, but it's got a lot of side effects. And you have to give it with vitamin C because it needs an acidic environment. And it has this ketoconazole has this a couple weird side effects. It suppresses suppresses cortisone, but it also suppresses testosterone and can cause infertility in male dogs and intact male dogs. And it also causes lightening of the hair coat and dry skin and hair loss and itching and a lot of hair coat and skin signs. So I wouldn't recommend ketoconazole anymore. There are better things out there. Um, and the one to start with is the fluconazole. Um, the fluconazole for valley fever is used at a very high dosage, and I use it at probably the highest dosage recommended right out of the gate because valley fever is serious. We need to get it under control quickly. And so 10 milligrams per kilogram twice a day is your standard dose for fluconazole for valley fever. So we really hit it hard. We are not afraid to um, to use high doses with it. Um, if the dog does not tolerate it, then we have to go easy on that. But we have to find out. And if the dog does have side effects, things like drinking a lot, peeing a lot, incontinence, nausea, vomiting, lack of appetite, that's a big one. And that's frustrating because you don't know, like, is your dog not eating because of the fluconazole or is your dog not eating because of the valley fever or both? So that's always a tough one to determine. Fluconazole also causes a lot of skin side effects, and these are um, misdiagnosed a lot because they just look like bacterial skin infections. So rashes, dry skin, even hair loss. And a lot of times it's from the fluconazole. So we need to make some changes. Either need to reduce the dosage um, or switch to another antifungal, or we need to reduce the dosage and add antifungal um, herbs, for example, which is an option. The other weird side effect with fluconazole is it'll cause this goopy yellow green discharge from the eyes. And it's like, well, is that the valley fever or is that the fluconazole? It's always a tough call. So you have to have a veterinarian that can help you navigate these side effects and a veterinarian that knows what to watch for with these side effects. And, sometimes we have to take a vacation from the antifungal and see if that problem goes away. And then that would confirm that it's from the antifungal and not the valley fever. If I do something like that, if I take a little vacation from the antifungal, I'm always supporting the dog with other antifungal medications, and primarily I use herbal medications. And we're going to go over that next week because that's another big area. Fluconazole also causes elevated liver enzymes. All the azoles, all the antifungal drugs will cause elevated liver enzymes. Um, and sometimes you have a complicating factor, meaning valley fever can affect the liver, and then the drugs can affect the liver. So it's always good to have your dog on some kind of liver support while they're taking antifungal drugs, something like milk thistle, for example. And a lot of veterinarians um, are um, aware of that, and they'll use Denamarin. And Denamarin is SAMe with one of the chemical constituents of milk thistle, silibin. But what I do is you can use the Denemerin, but it's always good to add milk thistle with it. And I have a milk thistle glycerate in my Valley Fever store on my website. So when you add the whole herb to a product that's just using the chemical constituent, it freaking supercharges it. So it makes it work better. All right. The other thing that we see with a lot of these antifungals, including fluconazole, is it tanks the cortisol. So it really affects hormones, and cortisol is one of them. And cortisol is needed for um, the immune system. It's a hormone from the adrenal glands, and if your cortisol is low, you don't respond to stress very well. And um, the one way that we address this, and a lot of times we address this unknowingly, because a lot of dogs will have inflammation, like inflammation in their lungs, inflammation in the neck, causing a lot of neck pain when they have valley fever. And a veterinarian will prescribe prednisone to control that. And what prednisone also does is it boosts that cortisol. It helps those adrenal glands respond to stress. So it's actually helping the dog in other ways besides as an anti-inflammatory. It's helping them as a hormone, which is freaking fantastic. And what I've found is, although we don't like to use a lot of prednisone because it's immunosuppressive, we're using it at anti-inflammatory doses, not immunosuppressive doses, and it's also helping other problems that the dog may have. And a lot of these guys that if they're just on antifungals and they feel like crap, they're just dragging themselves around, have no energy, it very well be low cortisol, and you can check cortisol very easily with a urine sample. Your vet can check a urine sample for cortisol levels, and if it's really low, your dog needs a little supplementation with prednisone. So it's not always a bad thing to do prednisone, FYI. And fluconazole is not the only antifungal that does that. All right. So if your dog has a reaction to the fluconazole, or what usually happens is your dog is not responding to the fluconazole very well. And this happens a lot in conventional medicine because they're using just fluconazole. They're not supporting the immune system. So, like, the dog's just not getting better. The titer is the same. It's just, maybe the titer goes up, and conventionally, what will happen is the veterinarian will reach for a stronger antifungal. And usually, what they reach for is itraconazole. The other reason itraconazole is used is because in people, it's the antifungal of choice when valley fever moves to the bone or joints, or bones and joints, because it can be in multiple places at once. So in people, when it goes to the joints or the bones, itraconazole is the antifungal of choice. And honestly, that's what we think is going on in dogs, but there's no research on it. Um, so if your dog has a bone lesion or has severe joint pain, like in people, valley fever likes to go to the knees and the ankles. In dogs, what I find is it likes to go to the hips. And so these dogs have really severe hip pain, and that may be a dog that needs to be on itraconazole instead. The interesting things about itraconazole is it has to be given with food, and um, the capsules have to have little beads in them. When you look at the capsule, when you can see through it, it has to be like these little beads and not a powder. So you have to be careful with that. Um, Itraconazole is more potent than fluconazole, but it's also harder on the liver. So I've seen this mistake before. So the fluconazole, um, maybe causes really elevated liver enzymes, and everyone's like, "Ah, we need to change to a different antifungal." And so they'll reach to itraconazole. And I'm like, "Ah, it's it's worse on the liver." So don't do that. We'll talk about other ones we can do that with. Um, the other thing with itraconazole is we want to use caution with dogs with heart problems and kidney problems. So we need to use lower doses or maybe not use it at all. So we need to be careful when they have pre-existing kidney, liver, or heart issues. All right. The If your dog, um, if they don't respond to fluconazole or they have reactions to it. Oh, did I go over reactions with the other reaction with itraconazole is they can have really severe skin reactions, and it's called like it's dermatological necrosis or something. It's basically when they have these horrendous hot spot like lesions and the skin is like falling off. It's horrible. So that can happen with itraconazole. It can also, like I said, elevate the liver enzymes. It can lower blood pressure. That's why we don't want to um, use it really with our heart patients. And it does cause loss of appetite a lot with just like the fluconazole. So those are the reactions with itraconazole. Okay, so if we don't want to do itraconazole for whatever reason, we don't want to do fluconazole with a patient or a dog, but we need them on an antifungal, and a lot of vets are actually reaching for posaconazole, which is one of the newer antifungals, and it's usually used for severe cases of valley fever in dogs or resistant cases when the other medications are just not helping. And this is common conventionally because, again, they're just using an antifungal. They're not supporting the immune system. And when you do that, you're forced to go to a stronger and stronger antifungal to get the problem under control. Whereas holistically, we um, we boost that immune system right out of the gate so that we don't get into this situation, and that's critical. So Posaconazole, is actually a pretty nice antifungal. It's got excellent tissue penetration. It really does a good job, getting valley fever under control, but it does affect the hormones like the cortisol and testosterone. So it'll tank those hormones and maybe cause some secondary problems. Um, the dosing, there's a wide range of dosing for posaconazole, and because we don't, I don't think we have a real good handle on it. We definitely want to monitor um, blood work to see where we are. Um, and you can actually do blood levels of the drug. So you can do drug blood levels to see where you're at if it's helpful. But I think that there's not a heck of a lot of information on that, but there is some. I generally use posaconazole at the lower end of the dose and once a day instead of twice a day because it tends to be pretty expensive. And I found that when I use it, I'm also using immune support. Um, and I don't need to use really high doses with posaconazole. So that's a good thing because if you can do things um, that will allow you to lower the dosage of the antifungal, you're also lowering the chance of side effects from that antifungal. So if you can keep them on a lower dose. And generally, I find with posaconazole, I don't need to use a really high dose, which is good. Um, The other one that's being used in dogs that's fairly new is voriconazole. And this one also has good penetration into the tissues, and it's really good for central nervous system like brains, spinal cord, eyes. So if those are the areas where the problem is, then voriconazole is your upgraded antifungal. So um, they voriconazole can have also some weird side effects. So, if you're at the point where you're using these really high power antifungals, um, you need to add other stuff in if you haven't already. But anyway, the things that we need to watch for with the voriconazole, this one has some weird side effects, and we're not sure even if it happens in dogs. Um, the literature at this point doesn't have a lot of side effects listed for dogs, but in people, they can get visual disturbances. So who knows? Maybe that happens in dogs. In cats, so you can actually use these drugs in cats too. Cats get valley fever. Cat Cats have a different presentation of valley fever, so um, they get more skin lesions and bone lesions and things like that, as opposed to the respiratory stuff that we see with dogs first. But in cats, when they use voriconazole in a cat, it causes lack of appetite, lethargy, elevated kidney enzymes, a wobbly gait or walking kind of drunk, hind limb weakness, salivation, and pupil constriction. So those are kind of weird. So that's what they see in cats. So I would say that you probably should watch for the same thing in dogs, even though they're not exactly the same. I would still watch for those things in dogs. Um, all right. So in the chat, what medication is your dog currently on? So let us know in the chat. And we're going to go on to some other drugs. So those were all fungistatic. Those are all damaging the valley fever fungus, but not killing it. So I'm going to go over a couple that actually kill it, which is great, but they do have their idiosyncrasies. So amphotericin B is fungicidal, so it actually kills valley fever. Um, but it's given IV, and the nickname for amphotericin B is amphoterrible B, because it is very toxic to the kidneys. And so this is a major limitation with it. So it's like, if you have to use it in a dog, you need to be aware that kidney damage is very possible. There are formulations of amphotericin B that are less toxic to the kidneys, but they still are. And they basically, um, it's a liposomal formulation, which helps protect the kidney tissue. But that product is also very expensive. So that's another limitation. So the toxicity and the expense of amphotericin B. So it's usually used for dogs um, that have severe valley fever, rapidly progressing, life threatening. So it's like it's a Hail Mary. And honestly, I've never had to use it. So thank goodness. By the way, there is an IV version of fluconazole. So that's actually used too. And I might choose that before I would choose amphotericin B, honestly. The other fungicidal antifungal is terbinafine. And terbinafine is not an azole, it's a different class of antifungal drugs. And this one um, is not great for valley fever in the lungs because it doesn't get into the lung tissue. So it's not one you can use for lungs. and it's honestly not a standalone valley fever antifungal. It's not good alone. It's only good if you pair it with another antifungal to kind of boost it. And usually what happens is, a dog will start on fluconazole and have to be moved to itraconazole, and that's not cutting it. So instead of moving to posaconazole or voriconazole, they'll add terbinafine to the itraconazole and do a combination therapy and see if some of these stubborn or resistant cases will respond to that. All right. So um, the complications with terbinafine is it can permanently damage the sense of smell of dogs, people, anybody. Um, so with working dogs that need their nose to do their work, you do not want to use this. The other things that can cause are liver problems, like all our antifungals can cause liver problems, upset stomach, skin reactions, and even eye swelling and conjunctivitis. So this is another one that can cause eye infections. It looks like an eye infection, but it's from the actual drug. And terbinafine is best given with food. So that's an interesting one. Um, big picture is pharmaceuticals are powerful. They're necessary for most dogs with active valley fever, because valley fever can be fatal. It's nothing to be fooling around with. We need to use our big guns if we can. But the thing is, they don't support the immune system. They don't repair tissue. They don't calm inflammation. They don't protect the liver. They do the opposite of that. So we need to use other things to support the immune system, protect the liver, be anti inflammatory, repair the lungs, that kind of thing. So, so doing a combination therapy with antifungal drugs and supplements and herbs targeted to what's going on is really, in my opinion, the best way to go. Uh, so I have a Valley Fever online program. It's a DIY program that you can get all this information and get the information on the pharmaceuticals, but also information on the immune supportive supplements, the natural anti-inflammatories, natural pain um, herbs, antifungal herbs, and I'm gonna put it up there. That's the Rescue Your Dog from Valley Fever DIY program. So I encourage you to join the program. It's got all kinds of videos, on-demand videos to watch, and all kinds of information for you to help your dog get from valley fever to recovered. So I really recommend that. And honestly, the most successful recoveries of dogs with valley fever have been pet parents that combine the pharmaceuticals with immune support, liver protection, anti-inflammatory and analgesic strategies that are natural, and looking at the whole patient. I mean, there are things like NAC that we can use for scarring in the lungs, and a lot other antioxidants. There's a lot of fabulous things. And so, my Rescue Your Dog from Valley Fever can help you with knowing what to do for your particular dog. Okay, let's see. So let's go over some common mistakes that I see with valley fever antifungal treatment. Probably number one is with fluconazole. Um, a lot of people want to get it cheaper, or they want to get it in a smaller dosage, and so they have their vet, or vets are prescribing the compounded fluconazole, and the compounded fluconazole for some reason does not work very well. And that is one of the major causes that I see, well, probably everyone sees because it's in all the literature, that we see for, um, failure of fluconazole to work is because you're using a compounded version. So you wanna use a human generic version of fluconazole. And there's actually a research study that is being done on the different brands of fluconazole, because different brands of generic fluconazole, some are better than others, and that's really interesting. So that can be another little problem with fluconazole if the dog is not getting better. The other thing I see is pet parents that stop the medication too early. So valley fever convention when we treat valley fever conventionally, we generally say it's gonna take 9 to 12 months to get rid of, and that's your simple respiratory infection with feeling lethargic and icky and achy and with the fever, just your run-of-the-mill valley fever. It takes 9 to 12 months to get better. So what I'll see is pet parents are using fluconazole or another antifungal for, like, 3 months, and the dog's doing good, and so they discontinue it. It's gonna come back. That 3 months is not enough. The only time I have seen valley fever get better in 3 months was someone that was doing, or having regular acupuncture done on their dog, along with the antifungals, and doing, herbs and supplements for valley fever and all the different symptoms. So I have seen some cases get better real fast, but they're not using just an antifungal. So we can't stop the treatment too early. We can't stop treatment, um, when they feel better. That's what my kid did. My kid has valley fever, and he was starting to feel better, so he stopped his medication, and guess what? It came back. So, yeah, it happens. It happens. So don't stop your medication too early. Keep your dog on the medication, keep doing your regular lab work. Um, you wanna check your titers, and it depends on where your dog is in valley fever in their journey, um, with how often you're doing lab work. Sometimes it's every month, sometimes it's every 3 months, sometimes it's every 6 months. It just depends on where they are in their journey. So you wanna check titers, you wanna check blood cells, you wanna check, um, liver and kidney values and protein values, you wanna check thyroid. So those are your biggies that you wanna keep checking, and you may wanna check the blood levels of the drug they're on. So I actually have a at-home testing bundle. I'll put up the QR code, and this is an at-home valley fever test where a technician will come to your home, draw the sample from your draw the blood sample from your dog, um, and it does a CBC, a chemistry panel, which is liver, kidneys, proteins, electrolytes. It does a thyroid, and it does a valley fever titer. So actually, and it also does a heartworm and tick fever and Lyme and anaplasma test. So it's catching those too. So it's great for a first time test if you're unsure if your dog has valley fever. Um, and it's a good one just to keep tabs on, as you go along with uh, your dog's treatment. But plan on your dog taking 9 to 12 months to get better, and longer if it's in the central nervous system, like if they've got seizures, or if it's in the bones, it's gonna take longer. It's gonna take years. And so you definitely wanna add other things. There are actually herbal formulas for the bone lesions. There are herbal formulas for seizures. So it depends on your dog's specific situation. All right. But the Valley Fever testing bundle is awesome. And then it gives you some resources. Um, and I can help you with a lab interpretation if you need it. There's actually some information in that you will get with the Valley Fever testing bundle on um, how to look at the lab work and kind of figure it out on your own. Um, but that can be complicated too. So I'm always here to help. All right. So let's see, other mistakes. Not monitoring blood work. That's a mistake. Yeah, so let me put that back up. We need to keep track of those liver enzymes. We need to keep track of the valley fever titer. We want that titer to be going down. A lot of times, what'll happen conventionally is if the titer gets to a low level, meaning less than 1 to 8, and it kind of stays there for a long time, and the dog is clinically doing well, meaning there's no symptoms, a lot of vets will try taking them off medication, and then it's just like, you just gotta wait and see if it comes back. I have a little different view on that. I don't stop medication, till they're negative. I sometimes will stop antifungals when they're low, and when it's real low and it stays real low, but I'm always adding antifungal herbs, um, antioxidant, anti-inflammatory herbs, supplements, mushrooms, things like that. So I'm covering all the bases, and so I don't leave them high and dry without an antifungal. I've got them on an herbal antifungal um, to help them. All right. So we don't. I don't like to play Russian roulette with valley fever and kind of wait and see if it comes back. I want them negative um, before I stop things. And honestly, dogs are going to be on supplements lifelong, as far as just immune supportive supplements. So that's just a different way that I practice. All right, so let's see. Another common mistake is treating medication like fluconazole as the whole plan. Like that's it. Like your dog gets diagnosed with valley fever, they get on fluconazole, and that's all you do. Um, that some of them get better, a lot of them don't, and the ones that are on that kind of protocol take a long time to get better. A lot of times. Unless they're young and have a great immune system, and it was just kind of a fluke, and they got a big blast of valley fever spores. But I would rather do a comprehensive approach and work with an anti-inflammatory diet, support the immune system, protect the liver, do antioxidants, do things for all the different issues as natural as possible, along with the antifungal drugs. So it's a holistic approach. So so not supporting the immune system with herbs, antioxidants, mushrooms, along with the pharmaceuticals is one of the issues that I see. And what happens is dogs get labeled as non-responsive valley fever. And I've seen that several times in the consults I do, where there's nothing else the conventional vet or the vet specialist can do because they're just using pharmaceuticals. And so they label the dog non-responsive valley fever because they can't fricking get it under control. And that happens when you're just relying on antifungals and NSAIDs like carprofen and appetite stimulants like Entice. Those things all destroy the endothelium, which is inside the blood vessels, which then cause widespread inflammation in the body, which is a whole nother talk. And if you want more information on that, go check out my Substack because I've got a lot of information on that in my Substack. There is my general Substack page with tons of information on holistic pet care, both for valley fever and other issues. Okay, let's see. So next week, I'm going to do another live video, but I'm going to talk about botanical antifungals, which are exciting. And one of the exciting things about botanical antifungals is a lot of them are fungicidal. So a lot of them actually kill the valley fever fungus. Um, they don't just stomp it down and wound it. They actually kill it. And there are plants from all over the world with real research backed information. So they know the mechanisms that the antifungal herbs use um, to kill the fungus. And there are plants that you can use that have research against valley fever and then other fungal infections, which um, with herbs, if there's research that, it works in another fungus, you generally can use it for all the funguses. And with herbs, we do combinations, we do formulas that are synergistic. So we're using several different herbs to work together. And then, 1 plus 1 does not equal 2. 1 plus 1 equals 10 when you have synergy inside a formula. So they help each other. The other really cool thing about herbs is when we use them together with synergy, they actually um, can reduce side effects, because herbs can have side effects, but when you mix herbs together, some herbs are going to cancel out the side effects that another herb would have and just leave its medicinal qualities. It's really quite interesting. All right, so let's see. Couple questions. So, how do I know if my dog's compounded fluconazole is the problem? Well, it probably is if your dog is not getting better. Um, and my recommendation would be to switch to a generic antifungal, a generic fluconazole, and see if your dog feels better and the titers start coming down faster. Because usually what'll happen on a compounded fluconazole product is the titers won't come down. You'll have this titer that's the same for months or years, and it's a stubborn titer is what they call it. So I would just switch to the generic fluconazole. All right, another question. Can I switch medications if my dog's titers aren't improving? Absolutely. And that's the conventional approach. So if, for example, your dog is on fluconazole and they're not improving, a vet will switch them to maybe the itraconazole or the posaconazole. So that's that's valid and that's a conventional approach. Um, if you're not using anything holistic, supplements, herbs, like mushrooms, antioxidants, fresh food diet is foundational for the immune system. If you're not doing some of these supportive things, um, I might try that first. So if your dog is not improving, but is not having necessarily side effects, if they're tolerating the medication, I would look at other things besides switching to a stronger antifungal. I would focus on supporting the immune system with a fresh food diet, for example, mushroom supplements, depending on where the valley fever is. In your dog, there are different mushrooms that excel in different areas of the body. I would use antioxidants. I would use herbal anti-inflammatories. I actually have a custom herbal blend that does all of that. So the canine valley fever support tincture has antifungal herbs, anti-inflammatory herbs, pain relieving herbs, helps with the cough to get the mucus out, protects the liver, um, is antioxidant. So it's a nice formula. I'll put that. I don't think I have a QR code for that. So I'll put that in under this video, the canine valley fever support tincture. So A fresh food diet and some supportive herbs, if you're not doing that, would be my preference before you go to a higher power antifungal, which has more of a chance of damaging the liver and other side effects. Okay. All right. How long should my dog stay on medication after titers come back negative? If titers are negative, they can come off the pharmaceutical antifungals right away. And what a lot of vets will do is, if they're in, if you have still a bottle of fluconazole, for example, and your dog tests negative, they'll just have you finish that bottle, and then recheck, in 6 months or a year, or if they get symptoms again, because valley fever can become dormant, and that you'll get a negative titer, but it's still in there. It's just hiding. So you have to kind of always be on the lookout. So if your dog develops symptoms again, you need to do something right away. And after you've been through valley fever, you kind of know the symptoms. Um, but pharmaceuticals, once your dog is negative, they can come off of them. Um, but like I was saying, I still do immune support. So I'm still doing a fresh food diet. I'm still doing immune supportive supplements like mushroom supplements, just to keep that immune system, your dog's immune system, in tip top shape. Is it safe to combine pharmaceuticals with herbs? Absolutely. There are very few herb drug interactions. In fact, most of the herb drug interactions are positive, meaning the herb will actually help the pharmaceutical work. There's very few herb drug reactions. So I'm going to talk about the herbs next week, and they can all be used with pharmaceuticals. There's no reason to be scared of herbs. You should be more scared of Rimadyl, honestly. Um, all right, let's see. All right, so basically, these pharmaceuticals hold the line. They don't kill the fungus. They just kind of hold the fungus, you know, in place, kind of stomp it down, but they don't kill it. Um, so the dog's immune system needs to kick in and finish the job. So we want to support both. So next week we're going to take a deep dive into botanical medicine, and I'll also have um, information on the botanical antifungals on my Substack in an article. All right, I think that was all the questions. Let me check and see if there's anything on Instagram. Okay, so that's great. So have a wonderful Saturday. Thanks for joining me, and I will talk to you next week.